record this meeting. So there we go. Now it's being recorded in case we want to post it later. It's okay. If it'll let me, there we go.
Anyway, so we wanted to address some fast facts, just because I know, like, I wasn't quite sure of the prevalence, like, I was worried prevalence of some things, but others. So infertility affects approximately 186 million people worldwide, and couples that are struggling to conceive is pretty evenly split between male and partners cause. 1 in 7 women in the United States live with chronic pelvic pain, and that can be due to a lot of different factors. And then prostate cancer occurs in 1 of them. So some things to keep in mind. So throughout the presentation, we will be referring to sex assigned at birth, but we have made sure to include issues specifically as well. Typically, I'd say, put some ground rules, basically, no transfer, because we will develop considered issues and just being mindful of that, and also being mindful not to dismiss others' experiences that were different than your own. I know of the executive board, we have pretty varying experiences with our own reproductive health. You know, that's something very widely, whether it's other marginalizations that are impacting that or access to care. Reproductive health conditions are under research here. This is in part due to the study of patients having medical conditions. Endometriosis is for the tissues more. The things between 8 to 10 years for public services, doctors, messaging, to complete the diagnosis surgery, and most of the time they're in things that getting people with also while there are 4 stages, state is not always
Can I poke in there real quick as well? So also, I think, so it's important to know that endometriosis, it can affect not even just your reproductive organs, but it can affect, like, the endometrial tissue can literally grow on any organ. It has, in fact, it's been found on the brain, in fact. So, like, it's a full body condition. And like, that's part of why we're going in to do my diagnostic surgery, and why my doctor was more willing to do that was because we think it's growing on my GI tract. You know, because it's like, oh, well, your reproductive symptoms are managed. Cool. But I have these 500 other problems that I think might be caused by this. So I just wanted to throw that out there as well.
Is often characterized by extra cystic acne, there is a sort of usually one must go they often form this can be hormones large cystic first. And then political dysfunction is the abdomen dysfunction. It's often an issue for those who are being birth issues. Pelvic floor dysfunction can be helped with pelvic floor dysfunction.
Okay, and so now AMAB, reproductive health. So male infertility affects about 10 to 15% of males in the US for trying to conceive. So of course, that's only looking at the people who are actually attempting. There's plenty of guys out there that are not actively or never intend to have kids, and so they just don't know. Of the men that have fertility issues, 12% have untreatable sterility. So that means that they straight up just cannot have children whatsoever. 18% have treatable causes of male infertility. And then, but the vast majority have untreatable infertility, which means that they are able to produce children, but they will need assistive reproductive techniques such as IVF. Prostate cancer, as we said at the beginning, occurs in 1 of 8 men over their lifetime. And death due to prostate cancer occurs in 1 of every 44 men. It is most commonly diagnosed in those older than 65, but it has been found in people as young as 23. And then there are other conditions that affect fertility. So Jill was the one that made me aware of this one, that cystic fibrosis severely affects male fertility. 97% of males who have CF are infertile. And then diabetes. So 51% of diabetic men deal with subfertility. So not fully qualifying as being infertile, but still like having that lower sperm count or something that affects it. And then immune conditions can sometimes attack sperms. So just like how like my immune condition that I have, it attacks the good bacteria cells in my intestines. Some people have different immune conditions that for whatever reason think that the sperm are a foreign object. And so they attack it. And of course that brings your sperm count lower, which affects your fertility. And then there is trans reproductive health. So hormone replacement therapy can significantly impact fertility. That's not to say that there are not people who have like been on hormone replacement therapy and then have decided they want kids and have been able to like naturally have children, but it's still pretty uncommon. And there can be a lot of health concerns involved in that. Specifically, trans women who are on HRT, so who are on estrogen, can actually that can actually mediate, or actually no, I wrote that wrong. I'm so sorry. Trans men, so who are on testosterone, can mediate symptoms of PCOS, but it actually can reactivate endometriosis. So that's something really interesting to know. Specifically with PCOS, it was suggested that it'd be particularly helpful for trans men who are of older age, so who are going like through premenopause and menopause, that's actually super helpful to treat it because your body is used to having this higher level of testosterone. And then now all of a sudden, because of menopause, you don't. So actually giving your body more testosterone can actually mediate those symptoms. And then trans men may also have an increased risk of ovarian cancer. That's not something that's super researched yet. It's still kind of being looked at, but the theory behind it is that just like how PCOS, because you have higher testosterone, it affects, your risk of ovarian cancer. It's suggested that if you're on testosterone as a hormone replacement therapy, you might also be at risk. And then there's a really big thing for trans people being reluctant to seek sexual reproductive healthcare or healthcare in general, but especially for things regarding the reproductive system. They fear discrimination and disrespect. So they might not have a medical provider that they are super comfortable with. So they fear that stigma. Providers often lack appropriate clinical knowledge of treating trans patients. So there's going to be just like obviously cultural nuance and, just a difference in how you interact with trans patients. But there's also just straight up, there's going to be different complications and different worries to be looking out for trans patients that doctors often aren't knowledgeable of. And then there are still, unfortunately, a large number of providers that turn trans patients away, that just refuse to offer care, which I think is such bullshit. If you're going to be in any sort of like people saving, people treating, helping profession, like you need to be willing to help everybody. But I digress. Trans people also often have gender dysphoria when discussing or acknowledging their anatomy. So especially things like a trans man receiving a pelvic exam or a trans woman receiving a prostate exam could be super traumatic and super uncomfortable. And then there's also just a large number of trans people that have this idea in their head that like, oh, I'm a guy, I don't need this. But that's not necessarily true because although, obviously your gender identity is valid and it's important to validate that, you still have to acknowledge what risks you as a person are experiencing.
Also on the note of gender dysphoria.
Oh, yes.
An aspect of like trans healthcare that is kind of debated within the trans community is whether or not like for you to receive healthcare, it'd be a requirement that you have gender dysphoria.
Yeah.
Because for some trans people who they still like identify with like being trans and they still like identify as a gender non-assigned at birth, they don't get much, if any, gender dysphoria, but a lot of trans people who are referred to pretty commonly as like transmedicalis or trans meds say that it is required for you to have gender dysphoria for you to receive healthcare, and it, like, you have to want to pursue, like, reconstructive surgery.
like quote unquote full transition.
Yeah, like fully, like medically transition for you to be considered trans.
I believe I mentioned that, or I.
Yeah.
don't remember what circumstance I did.
Like I know that I personally have a belief that there's a difference between being gender nonconforming and being trans. And so like, but of course, like, and so like I feel like probably a lot of the people that don't have any gender dysphoria would probably more fall into gender nonconforming, but that's not my place to say. You know what I mean? Like you choose your label, you choose what you want to be called. Now, okay, well, I was gonna say one second, yeah. Okay. Because I also know that there has been a debate, and I will say that this one is one that I more agree with, that because there's apparently been this insurgence of like this wave of trans women who want to be allowed to go to an OBGYN. And I'm like, I understand that you want to be in a woman's space because you are a woman, but you like I personally am along that side of I don't understand what that doctor can do for you. You know what I mean? Like it's not for your anatomy.
I think
So
the only reason that trans women might want to seek like an OBGYN is for reproductive health care, but at that point,
but even then it's like
people who specialize.
yeah, it's like if
that's
you
more-
yeah, like, and it would make sense, like, again, if somebody has had, like we said, like that quote unquote full transition, and so they have, like, they have the uterus, or they have, you know, they have that cavity, and they want to receive services for that, that still makes sense to me, because, you know, there are plenty of cis women who have to use dilators and that kind of thing for pelvic floor issues and vaginal issues, so, like, yeah, that makes sense. But yeah, just in general, just, oh, saying, I'm a woman, so I want to be in this woman's space, it's like, well, it's just quite literally, I'm like, I don't know what treatment they can provide you. So I can understand, like, there's definitely still things that are in that gray area and are still trying to understand. And maybe part of it is because they're hoping like, oh, well, I really hope that this woman doctor in this woman's space is going to be more, like, less bigoted. I can see that. And like, if that's the case, cool, I understand that a lot more. And like, you know, I can fight on that side of it a little bit more. But yeah, there's just still so much of that. And that's something we're gonna talk about of the like, we just don't know. Like there's so little research. Go ahead, AJ.
Sort of talking on this, like, in my brain, I have like a solution, but I don't think it is actually a solution because it might just cause more, you know, bigotry and division.
Mhm.
But I personally think like there should be some sort of rebranding in a way, for like OBGYNs being specifically for AFAB or, women, well,
Yeah.
I don't know how to phrase it, but.
Yeah.
I don't mean air quotes women.
Right.
But like, I need like words circled around AFAB people and then prostate stuff. I don't. know if
Yeah.
that's
As a urologist, I believe that the
Yeah.
males go to.
But I know that might cause more division.
Yeah.
But like, if there was rebranding, I feel like a lot, at least I would feel more comfortable
Yeah.
with. I don't know, I don't think everyone would agree with that, but I would feel more comfortable, especially if the doctors in there were educated.
Yeah, and sorry, I was just gonna say, I know I feel the same way as like somebody who never intends to have kids. Like it sucks that an OBGYN is so like so branded and so entrenched in getting pregnant and having kids.
So when you want to have a baby.
Yeah. And it's like, or even just like, oh, just like birth control because I don't want to have a baby. But it's like, or the same thing, like I always hate, and it's not just for me that I hate that as somebody who never plans to have their own children, but I also hate it because of all the people that have miscarriages.
Yeah.
And like, can you imagine, and because this is a reality for a lot of people, having just had this traumatic miscarriage of a child you wanted to have, and so you have to go to this doctor because you had a miscarriage, and now you're just surrounded by pregnant mothers or people who have just had babies and pictures of pregnant women, and you know what I mean? Like, yeah, it's like why is it so centered around pregnancy?
Yeah. And also seen some research indicating that some practices have like sort of made this like separate rooms. So, like,
Yeah.
you know, it's not something that's nearly healthcare practices. But it's sort of centered around
Yeah.
other states.
Because I definitely think
But-
that that's needed for both sides of the trans spectrum.
yeah.
You know, it's needed for trans AFAB individuals who still have to go to a doctor to, you know, because they have to be checked for, you know, have pap smears and this, that, and the other. And, you know, it should be, like we said, for the other side where it's, you know, AMAB individuals, but who are, you know, are women and want to be in a safe space where they don't have to worry about shitty ass doctors. And I mean, don't get me wrong, like an OBGYN office sometimes also has shitty doctors, but it's like I feel like, yeah, I feel like when it comes to, you know, that kind of bigotry, I hope that it'd be lesser there than like if I had a male doctor randomly somewhere else. I don't know. I don't know.
Kayla, I thought you-
And then AJ also
Yeah, I
had
was
something.
gonna say, it's something that is so prevalent, specifically with. You have to find, if you're not looking to plan for a family, you have to find somebody that is not so desperate. Yeah, because a
Mhm.
lot of OBGYN, they say that they really focus on gynecologic care, their main thing is almost always sex.
I was gonna say, yeah, it's either that, it's like either getting pregnant or birth control, so avoiding pregnancy. And you know, I had the issue at the campus health center at some point where because they had not reminded me that I needed to do my annual physical, I was being late on my Depo Rivera. And I called the doctor like in tears, being like, well, what am I supposed to do? And she was like, honey, there are other ways to prevent pregnancy. And I was like, honey, I have endometriosis, and that's not why I'm on this medication. And she was real silent after that. So it's like, you like, there's just so many different things that are ignored. Phoenix says OBGYN offices can be hit or miss, whether or not they treat you right as an AFAB trans man. To be honest, you got to find a good one. Yeah, I definitely believe it. I definitely feel like, yeah, and that's part of what I was saying is like, they need to be safer spaces because you as a AFAB trans man, you still have to go. Like there is no other option for you because yeah, like you said, you feel uncomfortable going to one, but it's necessary. Exactly, because there's like you have to like it's literally preventative. It's for your safety to be checked for like screened for these cancers and this, that, and the other. So like yeah, like you have to go there. So it should be, yeah, nothing more dysphoric than going to one. Yeah, exactly. A lot of people feel that way because it's like this is such like almost cognitive dissonance of like I am this person and now I have to kind of pretend to be this person for a little bit. You know, I have to talk about this part of me that isn't really a part of me anymore. Like, yeah. Okay, I'm so sorry. Go ahead, AJ.
Okay. I have like three.
Okay, it's okay. Rapid fire, go.
So, like, having to do with like, forgot entirely. Oh, well. Moving on. So like, for me especially, I have trouble like, I know a lot of trans people don't have this feeling, but like, it is cognitive dissonance. Sorry, words.
I didn't know if that was the right term or not, because I feel like that.
That just because like I never really think of myself as having female genitalia, like I never really realized it because like I just don't think about it. And I just expect that everybody is. I was like, whoa, but don't talk to me about that if you know that that's wrong. I know that it's wrong, but don't.
Just like, shut up. Just look,
Let me
shut
know
up.
the solution, because that makes me happy.
Valid.
But either way, it's like that. But for me, that was my first thought, I think. And the second thought is that if you and for like any like AFAB trans people, I do have a doctor in Cooler that is pretty accepting. And I don't think she's very focused on you know, obstetrics.
Yeah.
At least in my opinion, she's been, I'm sorry, I'm talking about my medical experience.
Oh, no, that's good.
But she's been very supportive and she knows I'm trans. And, she doesn't treat me differently. I mean, like she just does her job and then she goes pretty much and says, come back again.
Yeah.
I mean, I remember my first thought. I mean, when I was having pain, when I was having pretty bad pain, she sent me to St. Joseph, Camlers, and Savannah.
Mhm.
And I got an ultrasound, which was my first thought, because I didn't like until, like, I feel like this is a flaw in, the sort of abstract,
Mhm.
thing. At the time, I did not know that ultrasounds were anything for others than pregnant women.
Oh, yeah, yeah.
I just, so I was really confused as to what was going in for. And like everyone there was pretty much older women, either pregnant or older women.
Mhm.
Or
Like probably premenopausal or something.
yeah. So like everyone was looking at me there. But,
Yeah.
back to the doctor. The doctor's pretty good. I can see if anyone had any questions, I can try to.
Yeah, I was gonna say, and if you feel comfortable with it, like you could totally say something in the LGBTQ part of the server and like let people know, like, hey, because I'm sure there's other trans individuals in the club that aren't here that would potentially like that information.
I'm not 100% confident because like it could just be my experience, but it's been pretty nice.
But still, it's nice to have at least one person to vouch for an office than to be going in completely blind. So, and like, yeah, because don't get me wrong, some people are going to have different views of different offices. Oh, sorry, Phoenix. AJ was basically saying that he has an OBGYN that he sees in Pooler that so far has seemed to be like pretty non-bigoted and has been just like, treating him like any other patient. So he'd be able to provide information like on where to find that doctor if you wanted it. So you guys could totally connect to the Discord server. Yeah, he said he'd love to have that information. So
It is.
yeah, it's an office within a hospital. But yeah, he says he uses one in Savannah because of insurance, but it's nice to know. Yeah, it's always good to know what your options are. And like I said, it's always good. Like even if so, like for instance, I know with a local gastro, Jill did not have a very good experience with him. Granted, it's because of a rare condition. Versus Jill's mom, like absolutely loves this guy. So I'm willing to take the risk and see him and hope for the best because I really don't have like any other input about local Statesboro gastros. So it's like, even though I know that there's been one not good experience, it's like going in not blind is good.
Certain amount of, even if the doctor's
Just
good with the
ignorance.
technical, there's a certain amount of ignorance, unfortunately.
Yeah. But yeah. And then I was also gonna say, like, yeah, I think a lot of people honestly don't know that ultrasounds are used for all kinds of things. Like I know I had to have an ultrasound on my heart when I was young because we thought that I had a missing ventricle. And just like, yeah, there, I mean, I'm pretty sure I know Jill and I were talking the other day, like if you had like a bowel obstruction or something, like how they know. And I'm like, I'm pretty sure it'd be an ultrasound. I'm pretty sure that's how they bless you again, maybe. I thought about it. Same thing, like I'm pretty sure when our roommate's boyfriend had his appendectomy, like I'm pretty sure it was an ultrasound for how they found it. So it's like, yeah, it's used for all sorts of things. Phoenix also has had an ultrasound for a heart as well. Yeah. Yeah, and so and he was also saying he's like once he gets his own insurance, he definitely will want to go to a more accepting OBGYN than the one he has now. But the one he goes to now is because of insurance. And he's also had ultrasounds for kidney issues when he was younger. And yeah, so like it's for all sorts of things. But yeah, because and like probably like honestly, me having the ultrasound on my heart when I was little is probably the only reason that I really knew because I've had one for something other than like gynecological reasons.
But I don't know.
I mean, no, it's like it's so good. Like it's not really that off topic. It's still, it's discussion.
I love.
Yeah.
When you're not.
Oh yeah.
Okay, so next slide.
That's very fair. Sorry, Felix was just saying they don't think they've ever had one for a gynecological reason. And I'm like, yeah, typically, like unless you're having like pelvic floor issues or suspected PCOS, you're not going to have one, really. Yeah, and I had both an external and internal ultrasounds once when I was younger to check for PCOS, and we didn't find it then, and then now just recently to check again for PCOS, which we did find it. So it's like unless you have those those like big concerns, those gynecological ultrasounds aren't gonna happen. Yeah, yeah, exactly.
Right now, and it's still a normal looking.
Yeah, like
Yeah.
cysts when ovulating are normal to a certain extent.
The only reason.
Yeah, so it's like if you, because I'm assuming that like, you know, it probably like, well, I'm assuming you had symptoms to a certain extent because that's why you were being checked out. But it's like if it wasn't absolutely debilitating, then it's like, yeah, they're probably just like give it a month, it'll go away. Which like sucks, but also it's like
I think.
you don't need to have surgery for something that's probably gonna come back. You know what I mean?
Yeah. Like, I know, sorry, I'll talk about that later because that's more about Jonah.
Oh, that's fair. Yeah, it's just like, yeah, it's just like they really don't want to do surgery on like even for PCOS cysts because they're just like it's kind of like you're fighting a losing battle. Like it'll go away on its own, you'll get a reprieve for a little while. Even if you have surgery, like, okay, cool, it's gone for now, but it's gonna come back.
Yeah.
And they're like, why should we cut you open 15,000 times, you know?
If they put raw,
Yeah.
if they cut it off. Like,
Yes, yeah, especially like cause cysts, like, yeah, if you don't get everything, then it's gonna come back anyway. Cause it's the same thing, like if you've ever seen Dr. Pimple Popper, like removing cysts, like they talk all the time, they're like, you gotta get the cell wall, you gotta get everything, because if you leave any debris in there, it's just gonna come right back.
You being a doctor, you being a Dr. Pimple Popper person makes total sense to me.
I'm so glad it does.
It
I'm
really
so
does.
glad you know
It
me well
really
enough to know that
does.
that's so on brand. Yeah, Dr. Pimple Popper person. Anyway.
I could never.
No, but, I did some research on the gender gap, because there is pretty significant gaps in like how we understand AFAB versus AFAB conditions. So there was a study examining how men and women responded to this. Basically, there was a period where they realized women that were taking Ambien were having a higher rate of car accidents. They were like, oh,
Something's not right.
something's wrong.
Like something's
So
not
they
lining
started
up here.
investigating the impacts of how the different drugs metabolize in AFAB versus AFAB people. And they found that 90% of cases, women experience the stronger side effects and experience adverse reactions at twice the rate of men. And we see in part that, you know, historically, women have not been equally
Examined in trials.
Yes. Yes.
Oh my God, yeah.
But there was, they were basically saying like, early on in these trials, like even like phase 1, phase 2, they wouldn't have any women in there. They would bring them in for phase 3 of the trial, like actually test out the drug. But like the stuff they worry about, metabolization of the drug, is always done earlier in the trial. So it's basically from the get-go, you've got a certain amount of research being put against women because it's what I'm looking at.
And let me tell you, this is a good thing for me to know because as somebody who has like noticed that I have much stronger like effects of Ambien on me than my dad. And like I'll tell you, my dad and I, like he may be a big man, but we're really not that different in when it comes to weight. Like I think right now we're only like a 40-pound difference. So it's not just that like, oh, I'm taking the same dose as him and I'm smaller. Like no, I usually take a half of his dose and I'm way more screwed over than he
Yeah,
is.
when I was doing basically a lot of women say, we are not just little men.
Yeah.
It's not as simple as just cutting our dosage in half.
Yeah.
And that's what the article said, which I considered. Thank you. But, and then as well as a lot of studies have found significant differences in how men and women are treated when seeking treatment for the same symptoms. In part, men who come in with the same pain as a woman are going to be treated much quicker than women, as well as they would be treated differently following the same surgeries. So it was found on here. But one study,
Get out of here, Harvard Health Publishing. Leave me alone.
one study even showed women who received coronary bypass surgery were only half as likely to be prescribed painkillers as compared to men who had undergone the same surgery.
Yeah, which is what I'm concerned about literally right now, because I was told by my doctor when I have surgery on Thursday, I'm gonna be given gabapentin as my pain medication. I took gabapentin every day for 4 years for chronic pain and it did nothing. So what do you think it's gonna do for me after a surgery?
Yeah, that's all.
I'm not liking that. I'm not liking that at all.
Yeah, women who gain are much sedatives rather than pain medications for illness, they're also much more likely to be prescribed antidepressants. I've been on antidepressants for several years. Is there any actual evidence that it's helping? No. Is that what I mean?
Yeah.
Then there was a study here, and this is so a 2000 study published in the New England Journal of Medicine found that women are 7 times more likely to be misdiagnosed and discharged and those had a heart attack because the medical understanding of heart attacks is based off of male physiology.
So like the whole thing that we have of like, oh, this chest pain, the pain in your arm, everything like that is what a male gets. That's what a male gets. And also, a lot of women don't realize when they're having a heart attack, or a lot of females don't realize when they're having a heart attack because it hurts just as bad as a period cramp or less.
Yeah.
So now I've been sitting here, like since I learned that fact like 3 years ago, and I've been sitting here and I'm like, as somebody who has chronic chest pains,
Real.
I'm like, how many times have I had a concerning, like it got to a point where my friend from archery was literally like, call me next time it's happening and I'll drive you to the hospital. Because I was like, I'm not gonna drive myself to the hospital if I'm potentially having a heart attack. Like that sounds dangerous. What if I crash and kill somebody? And he's like, I will drive you. Call me. And then of course, because he threatened to do that, it hasn't happened since then.
The power of the support system.
No, see, I just have to threaten my body that I'm gonna do something to it, and then it's like, hey, yo, my be bestie, just a joke.
If I tell my body that, it just doesn't work.
That's fair.
It just felt like I got it.
It goes through with.
Just like, oh, okay, I'll hit that button. Don't worry about it.
As well as there was a study that was looking at sort of how we fund diseases based off of disease burden. So essentially, the way that the National Institute of Health is supposed to be funding research is based off of the prevalence of these conditions. But it was found that women that diseases that predominantly affected women receive funding that was a fraction of what was awarded for diseases that predominantly affected men with a similar disease burden. I know this article, the main research we did, his daughter had chronic disease syndrome. So she was just like, why is no one funding this? This is a really big uptick in people developing CFS. Marijuana find out how much NIH funding was available to the overall women, make 3/4 of those affected by chronic disease syndrome. He discovered that CFS attracted the least amount of NIH funding against disease burden, measured in disability adjusted life years. So there's a bunch of basically public health, but that's the way they did it. They define disease.
Yeah, this is how they quantify it basically.
Yeah, this is public health science. It's a weird way to put it, but Marin later analyzed NIH data for other diseases, including those that predominantly affect men, such as liver and prostate cancer. In the majority of cases, diseases that predominantly affect women, such as migraine, headache, anorexia, and endometriosis, received funding that was only a fraction of what was awarded for diseases that affected men with similar disease burden. So basically, the funding ain't there. The funding's going elsewhere. And I know I saw when I was doing research, I think it was only 19% of men were affected by erectile dysfunction, but it received 5 times the amount of funding as PMS, which affects 90% of women.
Or I cannot remember the exact dollar amount off the top of my head, but outside of, like actual combat caused medical costs in the military, the number one thing they pay for their soldiers is Viagra. And it's like
a couple $100 million.
like literally it's
spent
a
on
stupid
Viagra.
amount. Jill's looking it up right now, so we can give you a
Just
dollar
stupid
amount.
I mean, like,
Yeah.
not just military, but
$41.6 million go toward.
Of
buying Viagra.
that's what your military tax dollars are going towards. Sorry, Phoenix. They're paying like it is $41.6 million that the military funding puts towards Viagra for their soldiers. So to go up against erectile dysfunction, like it's crazy.
But it's just to say that like all this money from erectile dysfunction, which you know, struggle is struggle, but also that's not killing. Versus.
He just said ... Oh, thanks. I hate it. Me too, Phoenix. Me too.
30% of
But just,
federal funding go toward the military.
but
Think
just,
of all the tax dollars going toward that.
listen, I don't need to pay for your.
I know. It's like, you don't want to pay for my schooling. I don't want to pay for your dick. Like, I'm sorry.
We're recording this just makes that better that you just said that.
Look. Our Phoenix says our military tax money is going to that. Then we need to stop paying taxes /J. /half J.
We just don't have enough money for public schools, but we will send elephants to the Middle East.
Yeah, fact. Fact.
That's also like
Yeah.
a true fact. They
Yeah.
send elephants to the Middle East, where it's literally nothing but desert.
It's like, of course. Yes. No, obviously.
But it's just to say that, you know, there's so much stigma around reproductive health, and we're paying for stuff that doesn't need to be paid for, certainly not that much. And we're just continually seeing on all the different sides that we could be underfunded, we're being underfunded. That's basically why I bring this up, and it makes me want to hit things. It makes me wonder if I should have gone into biology, psychology, some physics, so.
Yeah, Phoenix agreed with you, Vic. God forbid we pay for that, but not for good education.
But our next slide is sort of just impacts of stigma. This is some of the different things that we found sort of as a result of these things that we talk about, is sort of things around reproductive health.
So if you want, we could just go in order, like down the left and down the right of which ones we filled in. Okay. So one of the things I wanted to talk about was the development of male birth control pills. So because this was one of our trivia facts we had at our reproductive health tabling event. So, you know, currently there is no male birth control pills or injection on the market. But what people don't know is that this has been research that they've been trying to figure out since the 1970s. So that's really not that far after we started birth control research for women, which was the 50s. But why is there still nothing on the market? So the biggest things are, and this is, I linked to an article from BBC that I can also share in the Discord if anyone would like. But so one of the things is a lack of funding for research. So it's just basically been decided that like, we don't need that. It's fine. Like, it's totally fine. We don't need that. And so when there's not funding, there's not enough money to do those animal and human studies in order to actually like get a medication approved. There's also high attrition rates, which for those that are not like educated on research, attrition is basically like people dropping out of a study, whether because they die or because they just choose to retract their permission. So a lot of guys would sit here and would get symptoms that were totally expected by the researchers. And they signed off on consent forms when they started the study. But then they'd be like, ooh, I don't like having these mood swings and this increase in weight and this increase in acne. I'm dropping out. And so again, if you don't have subjects to look at and to test a medication on, you can't get a medication approved. And then there's also just this perceived lack of necessity. So one of the things that I had found in that article was it was approximately 20% of men in the US said they absolutely would not under any circumstances go on male birth control. There was 20% that said, yeah, I definitely think I would go on birth control if it was available to me. And then there was 60% that just said, I don't know, man. I don't know. And so that means that it was an 80% of a not yes. And so researchers and funding, you know, establishments and everything are like, well, then we don't need it. If only 20% of people would be willing to take it, then why do we need that?
I think it's also like a societal thing.
Yeah.
Because women being like,
It's the woman's responsibility.
it's the expectation that the woman take care of like reproductive responsibilities because they're the one with the uterus, which
Right.
is, it takes two to tango.
Right.
And also,
Oh, go ahead, AJ.
yeah, like, they wanna put everything on APAB/women,
Mm-hmm.
but then,
Get mad when we make decisions about
yeah, they won't let them make it.
For a proportion of men, the so-called clean sheets pills is emasculating.
it. Yeah, that's another big thing. And the thing is that I would like to point out as well. So all the way back in the 70s, so way back when this research first started, there was an injection that was found to be extremely effective. That like it's basically what it would do was it would put your little swimmers to sleep and they wouldn't swim for about 2 hours. And so it'd be like, okay, cool, you know, I can have this injection, can have my fun, and then like they don't do anything and they die off. You know what I mean? Like afterwards. That was back in the 70s. But they haven't been able to get it approved because of those side effects that the men refuse to deal with. So it's like we could have done this forever ago. It's the same thing. Like I'm a big person that's in that conspiracy of like we definitely have a cure for cancer, but because it like makes the US more money to treat cancer than to cure it. I'm the same, like I kind of feel like it's the same thing here, is like we make more money off of women being forced to do this stuff. So we're just gonna leave it how it is. Why fix what works for us?
Also, you perpetuate misogyny because like a lot of birth control side effects and like menstruation side effects like PMSing, acne, like all of like the side effects that's like considered like bitchy woman disease.
Right. Like, oh, you must be on your period. It's
Oh,
like,
like suddenly men aren't able to like be mad at women for having bitchy women disease for
right.
going through.
Or I love because this was another thing that I educated people on at our tabling event, was that people don't understand that, you know, you want to know what hormone it is that raises when you're on your period? Your testosterone. So I'm like, so when me, an AFAB individual, is on my period, that just means that my testosterone is closer to that of an everyday man. So when you sit there and you say that, oh, women are too moody and they're just too, you know, whatever, unpredictable to be president because of their period. No, bestie, that's what men are 24/7. Like that's what men are 24/7, bestie. Anyway, Phoenix did say they think that there's a new injection out that stops sperm from producing, if they recall. I would have to look into that. I will be honest, I didn't even bother to like see what the recent potential like advances have been, because I've just kind of assumed there's not. So like I totally believe that like that might be something that they're looking into. As far as I'm aware, it's not like there's nothing on the market yet, at least not in the US. Because our FDA says LMAO no. But I can totally look into that and see what I can find. Okay. Then there was AFAB individuals. It's okay. Oh, did you fill that out or did Jill fill it out?
We both did.
You both filled that one out? I'm sorry.
Yeah.
Go ahead then, Kayla. Go for it, bestie. You got it.
I did the first part, and you did the last half.
Oh, yeah, because we're pulling on that same arc.
Yeah. If I people.
Clinical notes have noted female patients as complaining of pain versus men who were experiencing pain. So it's like even just that belief is already there. Not the uterus swallow.
It's the sign from our doctors. Love gaslight.
But, you know, same as that researchers we were talking about earlier, like when men versus women are experiencing pain, doctors react in very different ways. And you know, it's shown in their clinical notes. And personally, I know in my experience with medical doctors, those clinical notes, they follow you everywhere you go. So if you got a clinical note where someone's like, oh, she speaks so dramatic, your next doctor's gonna see that. And you know, you can try to get certain things to get out of it, but that's another fight.
It's also just like, there's like for some ungodly reason love trying to gaslight you. I'm thinking, or like knowing the pain that you're feeling, because you could be like in excruciating pain and your doctor could just be like, have you tried not being fat?
Yeah, no, yeah. And like they don't recognize the fact it's like you're assuming that my condition comes because of being fat. You're not recognizing the fact that I'm fat because of my condition.
Like I gained weight.
Yeah.
Like it was
It's
Or because of the medication, like the birth
Yeah,
control for the
sort of.
condition.
Yeah. We would egg our house, wouldn't we?
Yeah.
Okay.
like countless amounts of like anecdotal evidence from like other AFABs who are just like, yeah, my doctor gaslighted me into thinking that I was not that big of a deal, but I almost died. Like,
Yeah,
like
I,
my doctor just said that, like quoting like someone else that I've seen in like the comment section somewhere, but they're like, yeah, my doctor said that I just need to work out more and like lose weight, but it turned out it was a cancerous cyst and I had like
yeah.
maybe like a couple like years of left if I didn't seek any professional
Yeah.
help.
Yeah.
And it's like, I will never forget this. And my new diagnosis really adds another layer to the story that I already tell. But I went to a neurologist when I started losing my vision. I got those clinical notes back and he had 3 paragraphs about my BMI and a sentence about me losing vision. Turns out I had a terminal illness that was causing me to lose my vision. It's like, you've got to listen to your patients, man. Like, this is just crazy pants. I hate the word crazy, but I feel
Or like-
that's a good reason.
Or like my sibling has been dealing with, and is still trying to seek answers for that they get, these very like POTS-like symptoms. Which they do not, they, like, it's not POTS, but it is that, you know, oh no, my heart is doing 230 for no reason.
The heart's having.
Yeah,
It's doing-
and like, I remember, like, went in for like some sort of stress test or whatever, and like literally that was when she got the note saying like, oh, I'm diagnosed with being a hypochondriac. Like you wouldn't be having all these symptoms if you weren't stressed about having all these symptoms.
It's like, I wish it were that. It's not-
Yeah, and like Phoenix says, speaking of healthcare, women/AFAB, pain is normally not taken seriously, which sucks too. Yeah, it's like, yeah, it's not, girl boss.
Was the was the AMAB one you, Gray?
Yes. 1 second. My friend is going grocery shopping for me, so I'm trying to like answer their questions.
That's a real predator.
I know.
I think
We were gonna go together and then I'm not gonna have time now because I'm gonna be working 15 hours tomorrow. Yeah, me too, Phoenix. I also have high pain tolerance, but just like, so when I'm saying it's bad, that means it's really heckin' bad. Like you should listen to me if I'm saying it's bad.
Yeah, but it's funny that he was like, saying all the time when he mentioned it. Because I have a baseline of it. Like there's a baseline of it. And versus like if I'm openly complaining about it every 5 minutes, it's bad.
Yeah.
It's like this one like lighthearted TikTok that I saw where it's like someone going into a doctor's office and they're like, all right, how much pain are you in? And you're like, oh, the normal amount. The normal amount should be 0.
Yeah. Or like I was the one that informed my dad. I'm like, baby, sweetheart, you do realize that a 10 on the pain scale is supposed to be the absolute worst pain that you can deal with and to still function.
I remember he said that.
I know. Like it's not like I am lying on the ground screaming and crying, throwing up like I'm going to die in the next minute. It's like,
Feels like I'm actively dying.
yeah, no. So like you're still able with very much difficulty, but you are able to do things. So like my dad, I was like, so my dad had forever been going to this doctor about his knee and back pain, going to the VA and saying like his pain was at like a 3. And then I told him this and he was like, so my kid recently told me this. And the doctor's like, yeah, bestie, do you want to give me your correct answer now? And he's like, a 9. A 9. Yeah. Yeah, that too is like,
Yeah.
so I'm just like, well, I consider my normal baseline pain as being 0, but that's not what it's supposed to be.
Or even like
My
like
baseline.
being, like having chronic pain, but like the pain moves every day.
Yeah.
Like sometimes I'll have like pain in my chest, sometimes I'll have pain in my like knee and ankle joint, sometimes I'll have pain in my head. Like it's literally a daily thing where I have pain somewhere, it just migrates.
Yeah.
Decides where it wants to live that.
Right.
It's like great.
It's studying abroad.
Just living the traveler lifestyle, you know? Living on the
My kid
road.
doesn't want to go to college, it wants to live in Italy.
That's a quote. Um, so of course, like, yeah, we talked about, and I feel like we talk pretty often about like the stigma that women and AFAB individuals experience in the healthcare system, because, that's normally what we're focusing on. But we did also want to talk about, so there is like a fair bit of stigma that surrounds male infertility issues as well. So there's a big part of feeling ashamed and feeling emasculated, which, although like as an AFAB individual, I can say that like I feel like that's so dumb to have to feel emasculated by it, but also it's like that's how society be. You know what I
Yeah,
mean?
and
Like
I
it
also
is
think
your
about, like-
job as a man to be manly and to be able to service and have children.
And it's like in the same way that like we're pushed those certain rules from day one. It's
Yeah.
like not downplay for each other. It's men are being having that pushed on them.
Yeah. Then there's also like in general, men are already less likely to seek medical help for just typical things, but especially when it's something that is so like embarrassing and like make you vulnerable as
Yeah.
this. Cause like, I mean, guys often don't even want to go for like preventative screening. So like it's hard to get men to go, hello? Oh, okay. You can come in. You're fine. Hello. Yeah, we're in the middle of the meeting now. Yeah, you're good. No, it starts at 5:30. It's 5:30 this semester. I'm so sorry, guys. You're welcome to sit and join us for the rest if you'd like. But yeah, all of our meetings this semester are 5:30. Who is your professor? Was it karate? I'll reach out to her and let her know.
It was like that. For the rest of the
Yeah.
semester.
You're totally
I was
fine. Like, no worries. And if you want, like, we can do a brief run through of the stuff that we already covered if you like are interested in it. But yeah, we're just talking about impacts of stigma with reproductive health. So like right now we were talking about, because we already went over female reproductive stigma. So like we went over female reproductive stigma. Also, like for the person that just joined, I'm so sorry if you might have been told that this meeting was at 6:30. Oh, hold on, she's still connecting to audio. I'll give her a second. There we go. Hi, sweetheart. I'm so sorry if you might have been told that our meeting started at 6:30. It started at 5:30. You're still more than welcome to stay and listen to what we've got going on. We're just in the middle of it. So I don't want you to be confused. I'm assuming that you were with Dr. Karate, and I will let her know that like that was incorrect. So it's okay. You're fine. So it's okay. But so right now, like, yeah, we're just going over the impacts of stigma with reproductive health. So we just finished talking about, the stigma with women and how, we're kind of just told to stop complaining and that we're being dramatic and, whatever. And then with men, it's people, feel very ashamed and emasculated if they have any issues with infertility or erectile dysfunction. They're very reluctant to seek medical help for quote unquote normal things, for like even a checkup, or like, oh no, I have the flu. I'm just going to tough it out instead of going to the doctor. So when it's something as embarrassing, like what they feel is embarrassing, they're especially not going to want to go. And that can even impact like preventative care. So I know it's a big joke, for instance, on I think it's oh God, I don't remember which of the stupid comedy shows it is that my dad watches. No, it's one with it's one with all the, yeah, but it's like all these like farm folk, all these country folk. And there was this whole episode surrounding like these guys not wanting to go get their prostate exam done because, like that's gay. And it's like, bestie, you need to have it, especially considering like we just like I talked about at the beginning of this, 1 in 8 men are going to get prostate cancer in their life. Like that is a huge concern, very common. So like, sweetheart, you cannot be nervous about like, oh, this is vulnerable. Like you gotta go. Just do it. It's fine. And so and then
the meme within like masculine spaces where they're just like, guys, fellas, is it gay to use a straw?
Yeah. Is it gay to look out for my healthcare? But so, and then the last thing was like, men are much more likely to receive these like really harmful jokes in response to like fertility struggles. So versus women, like if they say like, oh, my husband and I have really been struggling to have kids, like, we keep trying and we can't get pregnant, or I've had 3 miscarriages. It's a really supportful response to that woman, right? It's like, sweetheart, I'm so sorry. Like that's really upsetting. If a man were to say that to his friends or his coworkers, he gets these jokes like, oh, you can't get it up, huh? Like, it's like, dude, like it's not like, and it's not like any sort of flaw upon you as a person. Yeah, it's so common. Yeah, 10 to 15% who are attempting to have children experience fertility struggles. And even then, what we were talking about is like the vast majority of people who experience infertility, it's like 78 or something like that percent who experience infertility. They have what's called like an untreatable male fertility. So they're going to have to use things like IVF or something like that. Like they can have kids with their sperm, but it's just not gonna, there's no way to do it naturally. They have to have medical intervention. So it's like, it's so much more common than people think it is, and it shouldn't be the butt of these jokes, you know? And then I will say, Jill, I know you're the one with targeted legislation, but I do need to talk. Okay, so Jill was talking about like targeted legislation based on stigma and incorrect information for the trans community. So one of the things I really wanted to talk about with anti-trans legislation was puberty blockers, and actually Phoenix commented and asked like, what are puberty blockers? And I was like, I am so glad you asked. I will be explaining. So as a person in the trans community myself, I can still understand like the super big like anger and concern about children, people below the age of 18 transitioning. I can completely understand that concern, right? Like we don't want to let 12-year-olds potentially have these, horror, like, well, not horribly, but like largely, like literally life-changing procedures. But what people don't understand is a lot of legislation is trying to get rid of puberty blockers. All a puberty blocker does is it stops the natural puberty from happening. And as soon as you go off of that blocker, you'll have a perfectly normal puberty. It'll just be delayed. So let's say that I was a trans guy. All right. So I was born female. And about 11 or so, I'm realizing, man, I really think that I'm a guy. I could go on this puberty blocker, and that would give me time to realize and research and grow as a person, during my teen years. Am I really a guy? Or am I really a girl? Right? And so then if I realize I'm actually still a girl, cool, I go off the puberty blocker. I have a normal female puberty at whatever age I went off of it, let's say 18. If I am a trans guy and like, yes, I am actually a guy, I do want to transition, I get to then go on hormone therapy after I turn 18, start taking testosterone, and I will have a normal male puberty. So there won't be all these things of, okay, I need to have surgery to change my fat composition and my muscle composition. I need to have surgery to get rid of my breasts and that kind of thing, because I will have never gone through that female puberty in the first place. And then vice versa, if I was born male, wanted to be female, and I get to go, block my male puberty, go straight into a female puberty at 18, I won't have to shave my Adam's apple. I won't have to potentially like shave down my cheekbones to make a more feminine face shape. Like it's a completely reversible thing that can make the life of a trans person easier in their future.
Not free, but pretty commonly with cis.
Yeah. So there's this thing it's called precocious puberty. So over the decades, puberty, like the age of onset of puberty for both sexes have gotten younger and younger and younger. So nowadays you like typically have 11-year-olds starting their period instead of like 13, 14, which it used to be in the 90s. But so there's still what's called precocious puberty, which would be like way early. So if like a 7 or 8-year-old is having her period, like that's not normal. So that's why these puberty blockers were created to begin with. That's why these medications exist, was to halt that early onset puberty until they are 11, 12, 13, and then have them started at a normal time.
When I was in 5th grade, I had girls who were starting their periods at like 9.
Yeah.
I
Yeah.
remember that.
Yeah.
Yeah.
So
I thought I was dying when I got my.
yeah.
I was like 12 and I was like bleeding out on the soccer field in the middle of the week.
We love when we don't have adequate sex education from school or parents. But like
Literally in 5th grade, all they teach you is about like periods, and then they don't teach you anything else
No.
except for
Yeah.
abstinence.
Yeah.
They only taught us periods in 5th grade because like there's a PTA meeting about it. There's enough like parents were like, we need these children to know.
You know
I
what,
mean,
that's
good for
fair.
them. Good for
But
that
so,
PTA.
but so yeah, like these are medications that we have already for years been using on cisgender children to make their lives easier and let them wait a couple of years before they have their normal puberty. So it's like, it's super mind-boggling to me why we won't afford trans kids the same opportunity. And like I said, like if they decide when they're, you know, at any point, if they decide like, you know what, actually, I'm not a guy, I am actually a woman. Like I was born a girl, I am a girl, they can come off of it and have a perfectly normal period. So it's like there's no harmful effect except for like if you want to talk about maybe you know, societal bigotry of like, oh my God, you're an 18-year-old starting puberty. But like it's like if they and their parents have made that decision, why not let them? So like that, you'll see a lot of anti-trans legislation, like trying to, like obviously, like we said, like it makes sense to me trying to stop children from having surgeries, right? Or from starting like actual hormone replacement therapy. That makes sense. But you will see a lot of legislation trying to block these as well. Yeah, as far as I am aware, it's usually in pill form. I think they do also have it in an injection form as well, but it would be periodical. So just like how like you know, somebody who is on actual hormone replacement therapy, they usually do an injection like every month. Or I have a medication that's completely separate from you know, sex problems, that kind of thing. It's for my immune condition. I take that injection every 3 months. So it's like it a lot of times it depends on what's easier for the kid. Is it easier for you to get your 7-year-old to take a pill every day? Or is it easier to get them to come in and get a shot every once in a while? You know what I mean? But Phoenix is saying, all I remember is my grandma telling me how to use a pad and like explaining what a period was, but in a religious sense, not actually based on science. So for the longest time, didn't know the scientific reason for it happening, just that it happened. Yeah. Yeah, that doesn't help either.
On the topic of puberty block before we move on,
Yeah.
is it's so much easier to like societally deal with other people when you come off of puberty blockers at like 18 or whenever you choose to go off of puberty blockers compared to like you're 11 and you're feeling dysphoric because you're going
Yeah.
through the puberty that you
Is
don't feel
wrong.
right.
It's like the rate of suicidal ideation in trans youth is very high.
So high.
Rockets for puberty. Yes.
Yeah, it's so high. And so it's like that is the main thing here is like trying to prevent all of this mental and psychological anguish. It's like both because it's like for a typical trans individual, they are going to be extremely dysphoric and extremely depressed when going through their what they feel is their incorrect puberty. And then also now they're going to have to try to do all these surgeries to reverse things, like reverse these secondary sex characteristics that have popped up because of that original puberty. So it's like it's kind of killing two birds with one stone if we allow them to just block their puberty until they're 18 and then let them make a
And
decision.
I mean, similarly, you have a lower rates of self-care at the same.
Yeah.
I saw like a quote, I can't remember who attributed it to, but it was someone saying, like on the topic of like trans healthcare, that if there was a pill to reduce suicidal ideation in a population by 90%, 97%, you would call that a miracle drug. But
Mm-hmm.
people are so apprehensive to letting trans people get help that they need, even though statistically it is significantly more likely for them to like see suicidal ideation, have a genuine or generally like better quality of life, just like very positive like outcomes to it. Like there's only I think a 2 or 5% regret rate for having 3% getting these.
Yeah,
Like, sure. It's a statistical anomaly for someone to like genuinely regret being
Yeah.
like medically transitioned and like they feel more psychologically they feel psychologically worse than if they were cis.
Yeah.
It's just so bizarre.
Yeah, and like so there was a little thread going on here in the chat of like talking about how it can be so difficult to get proper trans healthcare. Like it costs a lot of money. And I said, yeah, people will travel across the country or even across the world to find a reputable doctor that will consent to doing these procedures. And then they were kind of talking about insurance, and it's like, yeah, insurance will like consider these things elective as if it's like I'm getting a nose job, you know what I mean? As if it's cosmetic, as if it's plastic surgery, and not something that is, you know, to keep me from wanting to kill myself. Like and so they won't want to cover it. And as somebody who is currently going to be having to pay off an over $4,000 hospital bill for my surgery I'm having on Thursday, I will be paying that off for the next 3 years. You know, and that's with insurance. And that's for a laparoscopy surgery, a medically necessary laparoscopic surgery that I have insurance helping me on. I am paying $4,000 out of pocket over the next several years. So what can you imagine this condition or these procedures that are like pretty intense surgery sometimes, especially like if it is like changing genitalia at all, like especially something that is so technically advanced, takes so long, usually takes multiple procedures to like get that final result. How much do you think that's going to cost when insurance refuses to cover it? You know, it's like ridiculous.
But another
Yeah.
form of targeted legislation related to reproductive health that I wanted to bring up. You know, in part, a lot of this anti-trans legislation kind of puberty blockers is, you know, based in misinformation. And we see the same with anti-choice legislation. Specifically, I think the Georgia's 6-week heartbeat bill.
Yeah.
Most women, when they are pregnant, do not know they are pregnant until they miss a period, which is at weeks.
So the only person that's going to know that they are pregnant at 6 weeks is somebody who is actively trying to get pregnant, tracking their cycle, tracking their hormones, like somebody who wants to be pregnant, right? So it is severely limiting people's access.
And I mean, just in part, you know, we're talking about these impacts of stigma, and this stuff is so far reaching, whether it's the legislation or how your disease will progress if you're not validated early enough or treated early enough. But that brings me to the next part, talking about period products.
Which we briefly brought up earlier, yeah.
Period products with scientifically tested blood instead of water. I think
Isn't that crazy? Isn't that crazy? Like, what the hell, man? Those are completely different substances.
Literally
Different
just like terrible
yeah.
already about it, how blood and water are not the same.
blood of the covenant is thicker than the water of the womb.
And I mean, in part, like this is, you know, coming from the stigma. This idea of
It's gross.
It's gross.
Embarrassing.
It's like, maybe it is, I don't feel nice when I'm on a period, but that doesn't mean that we should be blocking research from being accurate.
Yeah.
And you know, 1 in 5 women experience period poverty each month. So that means they're struggling to access period products or to function normally with those last period products. And we need better investments in this research to adequately equip everyone to function with their period. You know, we don't even have scientific researchers using blood.
Yeah.
It feels very off.
And Phoenix is bringing up the pink tax,
Pink
because
tax, that's a good one.
in most states in the US, period products are considered luxury items, and so they're taxed at higher amounts than other medical items that you can buy at a store.
And it's, you know, I talked to someone and they were like, well, condoms are free. Yes, condoms are free and they should stay free. That was, you know, a result of the HIV/AIDS epidemic, absolutely necessary. But I think we need to be saying the same thing with period products.
Yeah, it's the same thing. Like it was some sort of billboard that had said, why does Plan B cost this much, but my insulin costs this much? And it's like, that's not the question you should be asking. It is, why does insulin cost this much? Like you shouldn't be like tearing down this other population of people who are thankfully getting the resources they need in order to make your point.
It's
Like,
No one was like, well, what if we do charge Plan B like that and make insurance more?
right. It's like, great, thanks.
I think I saw one that was like, why is Narcan free but insulin is $500? And I was like,
Yeah,
Narcan
yeah,
shouldn't
yeah.
be- That's my response to that.
I think like the comparison that a lot of people make about like condoms versus period products is that like condoms are usually something you get by choice. And when you choose to have sex with someone,
Yeah.
period products are.
You don't get to choose whether you have a
Periods are
period.
completely involuntary.
Yeah.
If I could choose not to have a period, I'm sure 50% of the world's population would opt out.
And be
Yeah.
like, cool, let's not.
Phoenix said, that's what I'm saying. Yeah, so as we were talking about earlier when we were talking about trans reproductive health, so there are an unfortunately large amount of medical providers who will turn down treating a trans individual. And I will say this for the newcomers, as I said, for everybody else, that like I feel like if you are anybody who is going to be in any sort of helping profession, which, you know, medical, mental health, like, yeah, social work, anything like that, you should be willing to help everybody. Like you should not be saying, oh, I don't want to help poor people. I don't want to help drug addicts. I don't want to help people of a race or an ethnicity. You know, I don't want to help immigrants. You know, like, no, if you want to help people, you should want to help people. But this was a national survey that said 19 to 27% of trans people report being turned away from healthcare providers due to their trans identity. And that is just people who were willing to talk about that experience, right? So the actual number, as always, like with any survey, there's going to be a certain number of, you know, like wiggle room because of people who aren't, you know, chose not to answer or whatever. So it's like, I'm willing to bet that that number is realistically higher. And trans people also have to fear discrimination during their care. So, you know, I want to, if AJ, if you don't mind me using you as an example, you know, you were saying that you are going to this doctor. Obviously, this doctor has not refused you care, but you still, you know, were making the comment of, you know, oh, you know, she treats me like any other patient. It's like, that's good. That should be your baseline expectation. But there will be plenty of times where a trans person will get in the door. Thank God you're not turning me away, but you'll refuse to give me certain types of medication because I'm trans. I'll be considered like more likely to be seeking drugs than other people. You will refuse to do certain potentially life-saving procedures because, you know, whatever. Like there's or just, you know, the day-to-day kind of bigotry of refusing to use the correct name or pronouns. You know, well, are you sure you're really trans? Those kinds of things. So it's like,
Very micro.
yeah, it's like, even if you get in the door, what kind of care are you going to receive? So what quality of care?
You know, that's the culturally responsive care.
Yeah.
The kind of care that takes you in as a full person, not just a set of symptoms.
This is like a weird specific example of like what kind of care are you receiving, because like care is never the same, but like this is only an example because I grew up Catholic. Like
Oh no, me too.
Mother Teresa, for example.
Oh my God, no.
Her quote unquote humanitarian work in Calcutta, when realistically she just kept reusing the same needles and blankets that every sick person that came into her care used.
Yep.
Just objectively not actually bettering any of the sick individuals.
Getting these.
Yeah, in all actuality, just spread more illness in Calcutta. But people still recognize it as humanitarian work because they don't actually look into like what is going on under the humanitarian work. They're just like, oh, she's doing hospital. Let's give her an award.
Yeah.
Or maybe we don't give her award because hospital actually makes more people sick.
Yeah. It's like, maybe we don't.
Not.
Yeah. And I will say, because like Phoenix said, I wish that medical spaces would use correct pronouns or at least the correct name, to be honest. And I will say, like, I went to the Georgia Regional, East Georgia Regional Hospital today to do my like pre-op lab work. And I will say that there were signs up in several places saying like, hey, if your name or pronouns are different than what your records say, let us know. Like, you deserve to have respectful care, was basically what it said. So I was like, yeah. And so I'm like, so we're getting somewhere. Like, I'm not going to say these things don't exist because they definitely do. It's just not as widespread as we'd like it to be. And when I say widespread, it should be everywhere. It's just not yet.
Another wrinkle into the conversation is like access to care through people who provide it for you. So like right now, I'm under my mom's insurance.
Mm-hmm.
So I go to the doctor that my mom takes me to, which just so happens to be my entire life, like childhood pediatrician doctor that I've seen since like 6 months old.
Yeah.
So she is more likely to take me seriously if my mom is backing me up. But if it's just me talking about it, she's like, well, let's see what your mom thinks. Like, no, my mom isn't in chronic pain, and my mom's periods aren't the one that's like 9 days long.
Yeah.
You should be talking to me.
And then there's also, of course, like, also the concern of when you are on your parents' insurance, if your parents are not accepting, you know, they can get this itemized bill. I know, AJ, that was a concern for you, that like why you felt like you had to talk to your dad before starting hormones, because, well, he's gonna know, he's gonna find out. And so it's like that, like you shouldn't have to be put in this like vulnerable, potentially dangerous situation to get healthcare. Like, yeah. But yeah, that's super festive too. Always love that. Yeah, when I first started therapy, when I,
Yeah. My parents were the same way. They were kind of like,
Yeah.
what do you need therapy? I am traumatized.
when I first started therapy, my therapist, as soon as I would leave, my mom would put me out in the car, and then my therapist would tell my mom everything I said. That was what my therapy started as.
That's what it was like.
Yeah.
My
And the
mom
thing is-
threatened me with therapy. Like if I'd have a breakdown and she like witnessed it, she'd be like, I think I need a freaking therapy. I'm like, oh,
Like, honestly, please
you're making that
do.
sound so scary.
Yeah,
This is a somewhat off-base comment, but my mom just gave me.
Yeah, we joke about that a fair amount. Anytime she cried, just have some Xanax, kid.
Like it's like giving like kids in hundreds like cocaine.
Yeah, quite literally. AJ.
like, it was like, I had been going for like 3 months, and my dad saw the bill, and he was like, why are you up there? And then my mom was the one that was taking, she was okay with it. My dad was just like, you're not allowed to go for, I was just like, okay. And then I stopped going because I felt like literally threatened my life. And then she's my therapist. She's not a good therapist. Sorry, I just read. It's but she was like, well, you need serious mental health. So tell me when you want to come back.
Oh my God. You need serious mental help, so let me know when you want to come back and see me. No thanks, bestie.
That's insane to say to somebody.
It's like
When I was 14, I had a therapist called my mental illness.
always love that too. Yeah, being treated like you're a literal toddler. Yeah.
We got a little off the grid.
Anyway.
Individuals in healthcare is also like its own can of worms.
Yeah.
Phoenix zoned out for a minute and came back to here. No thanks, bestie.
Straight up dismissal.
Yeah.
That's rough, besties. I guess that's in part. This one decent. To kind of share that network of good experiences because for some reason they're few and far between sometimes.
Yeah, I always love those. Always love those. But
Why do you need another
Okay.
program? It's gonna be the exact same.
so this is the information for extra credit students. You're also more than welcome to stay, and we can kind of like walk back through the first half of the presentation if you are interested. I'm not gonna hold it against y'all that y'all are late. It's not y'all's fault. It's like, yeah, either she forgot and had a miscommunication, or I might have even typed it wrong in the email that I sent it to her, and that would be my bad. So yeah, like it was the last one that we had 2 weeks ago that started later. So I don't know if she got it like mixed up, or I don't know if I typed it wrong. Yeah, because you came to our last one, didn't you? Yeah. So yeah, it's like, but if you want, yes, Nicole, this actually is recorded. So we can totally reach out to you about it. If you would like, just drop your email for me, because I'm not sure if we're gonna post it, so I can at least email it to you. But I thankfully did record it, so I can totally send it to you so that you can check it out on your own time. And that goes the same for y'all. If you don't want to stick around, but you are interested in the information, this is being recorded, so you could leave your email with me and I can send it to you if you'd like. But also no pressure. Like no pressure. But I feel like it's been a pretty interesting topic and we've had a lot of discussions, so totally chill. Cool. Thank you, Nicole. I got you. I will write your information down and make sure that you get your credit. So, and then Davis Mundy, So. Security, and then this Monday, Homeland Security. Cool, I got you as well, Davis. And then Davis, you can also drop your email if you would happen to like the beginning, because I know you showed up a little bit late as well, but no stress, no pressure. I just want to offer you that opportunity. But yeah, no stress. I don't blame you if you aren't super interested in it. So.
I want my taxes to go toward you fixing the sinkhole in the roads, or maybe not. Yeah. Viagra.
Cool.
Yeah.
All right, guys, I am gonna go ahead and end this Zoom, since we have honestly been talking for a really long time. So normally we would hang out for a little bit afterwards, but I'm gonna go ahead and end it so I can talk with these other students if they want to go back through this information. But thank you all so much for coming. I appreciate you. Bye, Phoenix.
City more front.
Peace out.